which she will perceive while she is progressing with her trimesters or day to day of the pregnancy life. So I'll start with number one thing. Whenever there is, like, sometimes the female confirms the pregnancy when she starts having a symptom called nausea or a vomiting sensation, or like there is like non-palatable of taste, there is some taste change. So this is one of the symptoms when patient is doing, or a lady is doing a pregnancy test and she confuses whether she is pregnant. That's why she is having these change of taste or a nauseating sensation. So it is generally a symptom of pregnancy which occurs because of change of the hormone. But the same thing, the nausea and vomiting sensation, can become a complication if it is deteriorating the normal day-to-day life of the pregnant lady. And we say it as hyperemesis gravidarum. When there is an excessive amount of vomiting sensations or there is an excessive amount of vomitings. So when I say it is hyperemesis gravidarum, one should consult a doctor if there is a nausea which persists with fever and weakness. And we say that there is either a hyperemesis or there is a simple vomiting of pregnancy. And when there is simple vomiting of pregnancy, the symptoms could be, there could be, we say there is just one or two episode bouts of vomiting, which does not hamper her health status or the day-to-day activity of a pregnant female. There is no impairment of the health or daily routine, and it generally disappears after 12 weeks of pregnancy, or we say 3 months of pregnancy. And if the vomiting is persisting more than 3 months, then also it is of like concern, and one should take proper advice and proper treatment from the gynecologist for the concerned symptom. When we say it is hyperemesis, hyperemesis is only said when it is incapacitating the daily routine, or we say there are chances has decreased, we say because of the better facility or early registration. And that is why we say whenever there is a pregnancy suspicious, or like there is confirmation of pregnancy, one should start taking the treatment at the earliest with the doctor. There are like few risk factors for hyperemesis, or we say if there is hyperemesis. So it can be a familial history, there can be there if the pregnancy is at an early age, and if there is a low body mass, then there are more chance of having this hyperemesis. Or if the female is having a history of motion sickness, then she is more prone for hyperemesis. There could be a low carb reserve, we say, or there could be deficiency of even vitamins like vitamin B6, vitamin B1, and there is a decreased protein intake. And the complication can lead to even ketoacidosis. And when it is being entered by the gynecologist, there are battery of tests which we perform, and there are like different treatments which we start giving to the patient. But I would say there are few preventive measures also which are to be taken care of in order to have less of these symptoms. And these are like I all generally prescribe frequent small meals. It should not be a heavy meal 3 times a day. Better to have 6 meals but small chunks of food. Then there is a lot of fluid consumption should be done by the female. We say the water intake should be like 3 to 4 liters in form of either water or any other kind of like fluid. And there is like avoidance of the spicy food, the spices, the junk food, we say one should avoid, because it will trigger the smell as well as the hyperemesis. It will increase. Then what can be the other complication in first trimester? It could be like lower abdominal pain, which generally the female complains. There could be either bleeding or spotting. If patient observes in after confirmation of the pregnancy, she should report to the gynecologist at the earliest. And it could be mild spotting because of the implantation, or it could be early impending abortion, which can be taken care of. Or if it is heavy, then might be she is aborting. So the bleeding of any sort should not be ignored and should be reported to the gynecologist at its earliest. Then there could be urine infection. So the urine infection is one infection which should never be ignored, and the urine infection should be taken care at the earliest, because it can lead again to the pain, a lower abdomen. It can lead to even rupture of membranes in later pregnancy. It can lead to labor pains. It can lead to preterm labor. So all these kind of things can be just initiated with a mild UTI, and if not untreated, it can lead to complicated urinary tract infections. Then one of the most common nutritional deficiency, which is common in India, is anemia. Even the baseline hemoglobin when a lady become pregnant is not 10 gram of hemoglobin. When we say a healthy hemoglobin or a healthy female to have a pregnancy should have a HB always and above 10 gram. So all women with pain or bleeding, we say, should be considered in pregnancy to the gynecologist, and it should always be considered as pregnancy until and unless proved otherwise, we say. So we order an ultrasound to look forward to the site of pregnancy and the type of pregnancy. Maybe she has some kind of ectopic pregnancy, which is again a complicating kind of pregnancy, and it should be treated till the time it ruptures, or with either medicine or surgical intervention should be taken care of. When we talk about bleeding, it could be a threatened abortion, it could be a silent abortion, it could be any kind of inevitable abortion, there could be H mole. There are a number of reasons. There could be ectopic, which is most common when a patient comes into emergency with pain or bleeding. So, what all things to be seen is you should always look forward what kind of bleeding you are having, whether it is a fresh bleeding or it is just a clot which a lady has passed. There can be a fleshy mass which is being passed through the vagina. So, it should be properly documented by the patient. The history has to be properly taken and given by the patient, whether it is painless passage of clot, or if it is like painful passage of some clot or bleeding. Then the causes of abortion, when we say, there could be genetic, there could be like the most common trisomies, it could be an endocrine anomaly or endocrine abnormality which leads to this. There could be other causes like maternal infection, uterine defects, malnutrition, and even a slightest emotional disturbance even can lead to like impending abortions or threatened abortions. Now, when we talk about infections, when we do preconception counseling these days, we do take care of infection. Prior to having pregnancy or prior to get pregnant, the infections like syphilis, HIV, other torch complex, if something is present or positive, it has to be properly treated due in time. Then when we talk about like the structural causes or the structural malformations, the ultrasound always gives us a diagnostic criteria of any kind of uterine abnormality. Then we look forward for these things that the patient can abort if she is having some kind of uterine malformations. And we do have to see whether there is a singleton pregnancy or it is a multiple pregnancy, whether the age of the pregnant lady is too early or she is very young, or an elderly conception. So both the age windows are important. And when we talk about the habit, where we are living into a world of corporate where there are habit forming drugs, or we say the females are nowadays like they are smoker also, there is alcohol intake, caffeine intake, there could be chemical exposure, and there could be a history of any kind of CT or radiotherapies done in the past, which can make her more prone for the complications. Then the investigations as per the doctor, all the things are to be done and taken care of at the earliest, so as to conserve that pregnancy and to make the female go with pregnancy well in time, and with adequate nutrition as well as the treatment. Now, coming to the second trimester, when the female enters into her second trimester, that is more than 12 weeks, when she enters her 13th or 14th week of pregnancy, the normal nauseating sensation or the vomitings, they become less prominent, or they get relieved actually. So when the patient in second trimester, what could be the complication? We say there could be a rise in the blood pressure, there could be excessive rise in the body weight if she is not consuming a healthy diet or a healthy nutrition. Then coming to one of the one more complication, which could be because of the cervical dilatation, or there is some dilatation of the cervix, so that the patient aborts in her second trimester. So that needs to be checked in time, and proper treatment can be started, or there could be treatment modalities like cervical cerclage doctor is doing in order to conserve that pregnancy, or in order to take that pregnancy to the term size. Then again, the pain in second trimester is again, pain is a consistent problem in pregnant lady throughout the pregnancy. But the reason for pain in first trimester is different, in second is different, and in third is different. So in second trimester, if the pain persists and it is the uterine pain, which we say, then it is said to be as preterm labor. And the things which could be even seen in second trimester could be the bleeding, or there could be a pain on the previous cesarean scar if some female has delivered in the past by cesarean or any other surgery. There could be a surgical site pain which she can complain, or there could be heaviness in the lower abdomen. And because of the increased blood pressure, there are again a battery of complications which arises just because of the rise of the blood pressure in second trimester, and which keeps rising in, even in third trimester. Then in second trimester, or we say when patient enters into third trimester, this BP keeps increasing if it is not taken care in second trimester, and can lead to another complications like pedal edema, could be because of the blood pressure even. And without blood pressure, if there is some edema, it is said to be as the pedal edema of pregnancy. So in third trimester, when we come in third trimester, there could be a scar pain if she has undergone previous cesarean. There could be bleeding because of the placental separation, which is said to be as most complicating thing in the pregnancy, and it can lead to even IUDs, fetal loss, and even maternal mortalities. And high blood pressure can again give rise to many things like eclampsia, like pregnancy induced hypertension can give rise to preeclampsia or eclampsia like conditions, which are one of the leading causes for maternal mortality in our country. And but due time to the reporting time to the doctor can control the complication, and we can have a healthy mother and the healthy baby. Now, there could be in third trimester, the important thing which patient needs to take care is her fetal movements. So when we say the fetal movements, we say the patient to lie on her left lateral, or to see the fetal kick count. She counts the fetal movement on her own, and if at any moment of given time the movements are not there or the movements are reduced, then she should report to the doctor and get the fetal heart checked, and the proper investigations like color Doppler to see the flow uh, well in time. And if there is like pain which is not related to labor, then other reasons for the pain should be ruled out, like any kind of gallstone or any kind of stone or any kind of intestinal abnormality. So the whole abdominal ultrasound is also important. We cannot focus ourselves only to the pregnancy or the uterus. There could be other reasons which should ideally be ruled out if a patient complains. They ideally be done at least in the whole pregnancy time. And if there is like true labor pain, we say there could be false labor pain or true labor pain. In third trimester, many a times patient comes to us and say she is having some pain abdomen, or we say the false labor pains, and the doctor who has to make sure whether patient is going into the preterm labor, or she is going into the true labor pain, or it is just the false labor pains which are she is perceiving. And when we see the fetal movement or the fetal kick count, if there is any reduction or any loss of fetal movement, it is the first sign that patient notices, and when comes to the doctor, we are doing the fetal heart sounds. And when we see the fetal heart rate, if it is normal, we consult the patient and reassure her that she is having a healthy pregnancy going inside, with only the CTG machines we are doing, or by ultrasound, or by looking into the fetal heart rate. So when we say these are the complications, although the regular antenatal visits, when we say, there is a myth in the society that many a times the patients say she is not having anything abnormal, or everything is going normal. Why should I go to the doctor? So here comes the role of the obstetrician, who is like to whom you are going regular antenatal checkups. So in the regular antenatal checkups, we try to pick up the complication at its earliest and try to do all the precautionary measures as well as the preventive measures and the treatment of anything which we encounter or which we are detecting at its earliest. So the things are, or the complication before it arises is being picked up in order to give the treatment to the concerned person or the family to have a healthy baby sooner or later. Now, when we say a minor infection can lead anytime to the preterm labor, the most common infection is a urinary tract infections. It could be a vaginal infection. So, any kind of vaginal or urinary tract infection should never be ignored throughout the pregnancy and should be taken care of. So, when we talk about all these things, what are the basic things which a pregnant female can do at her own at home? So I would say she should always take a nutritive diet. The nutrition plays a major role to avoid a number of complications and to deliver a healthy weight baby, which we say in India more than 2.5 kgs at any time if she delivers, probably after 36 weeks of pregnancy. So the ideal baby weight should be more than 2.5 kgs. If she is delivering less than anything less than that, yes, we need to have a good setup of neonatal care where we can take care of the newborn. So the vitamin D content should be normal when she becomes pregnant, and the proper intake of the nutritions like calcium, the iron, the folic acid in first trimester, which is responsible for the neural tube development. And any kind of deficiency in the folic acid can lead to neural tube abnormalities or the congenital malformations, which are being detected on level 2 ultrasounds at any moment of time. And if it is a major complication which is life threatening, the pregnancy can be terminated if indicated. Then it should be like the take home message here is the female should never take stress, because stress is one of the reasons for n number of complications. Proper intake of folic acid, proper medications, proper antenatal checkups, vitamin C and vitamin D as a regular intake. Then the deworming is one thing which should be done, or which is regularly done to the antenatal patients in order to like relieve her from the worm infestations or any other infection. Now coming to one interesting topic, which is generally the females, they start complaining when she ends up into like her second trimester, is the skin changes, like the stretch marks which she starts bearing. So that is also like worrisome for the lady to have stretch marks either on the breast or on the tummy or on the inner sides of the thigh. So whenever there is an excessive stretching, it is because of the collagen fibers as well as the elastin fibers in our body. Whenever the uterus is enlarging, there is a stretching of abdomen, and because of the stretching, the stretch marks, they start coming on the skin. So in order to reduce the stretch marks, there are few measures which can be taken care at home, like the almonds is one of the nutritive substitute which should be ideally or regularly taken care, or should be taken by the female. Like I say, 5 to 10 almonds soaked at the night should be consumed in the morning, the first thing. Then the cocoa butter is another thing. The basic concept here is to nourish, to moisturize the skin as much as you can in order to have that elasticity maintained. So the stretch marks will be less if it is properly nourished either by cocoa butter or olive oil, or I say the vitamin E, which is very good nutrition for the skin. And the pregnancy marks on the face, we say the plasma of pregnancy or melasma, we say. So it is one of the sign of pregnancy, which the only thing which one can take care is the proper diet and nutrition, fluid intake, so that these kind of changes are less prominent on your skin. And if at all it is there, then the treatments are to be initiated by your doctor and with suggestion of the doctor. You should not keep experimenting on your own. Take the suggestions, go to the doctor at proper antenatal checkup visits, and make your pregnancy healthy, happier journey, because this is the most ravishing period for a lady or the family to welcome the newborn. And the concept of recognizing the symptoms and the complication at the earliest from our side is also to deliver a healthy mother and healthy baby to the society. So this is all I can talk about this, and whatever is the question, I'll be happy to answer if somebody wants to ask something on it. So questions, Ayushi? Okay, so I said the proper nutrition before one gets pregnant is one thing, because a healthy mother will have a healthy baby. That's the concept, or that's the take home message. And a healthy mother can only be when she is having a healthy diet, not on the junk food. So the proper nutrition, proper fluid intake, no stress, proper sleep, no anxiety, all these things will deliver a healthy baby. Yes, I said, because if a lady is overweight or starts having the high blood pressure, then there are complications which arises for the baby also and for the mother also. It has to be properly recognized well in time, and the treatment has to be initiated either in form of antihypertensive or even diabetes. If the female is having diabetes in her pregnancy, that we say as gestational diabetes, so she'll be more prone for having type 2 diabetes in her later life, and excessive weight baby, and the complications arises because of the diabetes to the mother as well as to the baby. The next question is, what is my personal 10-year risk of developing heart disease or having a stroke? Yes, I said there is more chances of having type 2 diabetes when she crosses her 35 years of age. She will be more prone. Any other question? I can't control my pregnancy related health history, but what things can I do? So you should see a gynecologist on regular basis, so that we can control all the complications because of either diabetes or hypertensive state, and we can give the proper treatment initiated to deliver you well in time, and a healthy mother as well as the baby in a good state of condition. And after even delivery, we do give you tablets or treatments or the precautions or preventive measures in order to not to have those complications in your later age. These complications can be taken care of. Any other question? As I said, have a nutritive diet, less in spices, or I say the fat intake, so that you become obese more than your BMI, start developing hypertension. And if it is hypertension or diabetes, I would say they are initially being controlled only on your diet, and if not being controlled on diet, then only we start tablets or in form of injections, anything for controlling all these things. So the first and the foremost preventive measure is your weight and your diet. You should not have a high fat diet or oil consumptions, or make your weight so high that you start developing these things. Your sugar intake should be proper. If you have a family history of diabetes, then the proper precautions should be taken care in pregnancy, that you don't consume much of the sugars, and it has to be in a proper limit, so that you don't develop that gestational diabetes. And if in case you develop also, then your diet has to be controlled. It should be tailored according to your condition and taken care by your diet, and if not, then being added by the tablets. I know exercise and healthier eating can go a long way to protecting my heart health. Are these resources to help me get started? Yes. So again, the take-home message and the major questions are being related to your nutrition and your body weight. So whenever you are having a normal body weight or normal BMI and a good diet and nutritive diet, if you follow, and a proper amount of exercise even during pregnancy, and your proper sleep, can make you deliver very well in time and a healthy state of mind. No, the too much vomiting is not normal. As I started my talk with this hyperemesis type of thing, which is an excessive amount of vomiting, which is incapacitating your daily routine activities, and your daily journey is being hampered. So it needs to be taken care at that moment of time, and you should have the proper medications in order to stop it or in order to reduce it. A normal amount of vomiting or nausea is a normal pregnancy sign, we say. Okay, so the take-home message I said, a healthy mother. So the healthy mother or mother starts with a healthy adolescent, and a healthy adolescent starts with a healthy diet to your kids who are into this age group of developing age. So the diet or nutrition starts with the developing age of a female child. When she develops into a healthy adult with a normal hemoglobin and a good nutrition, will have a healthy baby anytime, anywhere, whenever she wants to get pregnant. Then the proper fluid intake, the stress level which the girls are taking these days should not be taken that seriously. Pregnancy is such a journey which is the most beautiful journey in a female's life, so it should be enjoyable, and it should be enjoyed in that manner that you don't have you have the least amount of stress about the pregnancy, and a proper amount of sleep, I would say, will always help you to combat the complications or any kind of disease here. And the proper fluid intake. That's it, I suppose. So I think I have covered maximum things, and the general measures one can take at home also. So I would be happy to answer or to connect back to you on any of the questions or any of the topics which anybody wants me to discuss. I'll be happy to like share on that. Thank you so much.